Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Associated with bleeding and that associated with a clot. And the early diagnosis, of course, can be associated with recovery and resolution and dissolving the clot, whereas the bleeding, which is really a true complication of hypertension, is less easy to control. Anyway, I thought I'd just share that with you since those are issues that were emphasized in the post. So I hope all of you have gotten the double dose flu shot and that all of you have your blood pressure apparatus at home and you take your blood pressure. Some of you need to take it twice a day, some people once or twice a week, but it's something. So that's something as simple as a blood pressure apparatus, which may cost $50, is something that can really save lives, just like kidney screening and liver screening can help you. So something as simple as a blood pressure apparatus that can really keep your blood pressure under control, and if it's not, get help so it can be controlled. Any comments about that before we start?
Yeah, I have a question, Doc. So I've been on blood pressure medicine for probably 15 years, I guess, and I've had it changed, adjusted, because I was getting dizzy when I stood up, so my doctor switched. So I take 2 meds now, but I'm just wondering, is there any case that you know about where, because maybe of my lifestyle, starting to exercise and pay attention to my diet, that my blood pressure would get back to normal range without having to take the medicine? Is there any way that can happen?
It can happen, but the danger of that is if when you get your blood pressure controlled, you stop looking at your blood pressure and then it returns to the hypertensive situation as it was before. But I think, yes, the answer to that question is yes, that can happen. But you have to monitor it closely to be sure that your blood pressure remains controlled. The biggest problem that we find as we do our screenings, as Joyce could tell you, is that most of the people who are hypertensive know they're hypertensive, but they don't take their medicine or they don't check their blood pressure. And so the biggest issue is whether you use the sphygmomanometer and make sure that your blood pressure stays under control. If it stays under control for a significant period of time and you made changes, if your doctor decides to go along with those changes, then the important thing is to monitor your blood pressure thereafter, sometimes twice a week, just to make sure that you stay in control. As long as it's controlled, whether you're on blood pressure or not is not really the issue. The issue is to make sure that your blood pressure is controlled.
Dr. Callender, when you say control, what numbers are you talking about?
I'm talking about, I'm glad you asked that question because they seem like they change every year. Mm-hmm. But I think everybody is clear that the ideal pressure is 130 over 80 or below. Some people will accept 140 over 90, but I think you probably should shoot for 130 and lower. That's what I would say, but there are differing articles that will talk to you about 120 and some 140. So I would say shoot for 130 or below.
Dr. Callender, another question. You talk about people um, 65 and older. So now you're talking about a group of women who are at the age where they can get pregnant. And so the checking the high blood pressure and all that brings the age down, because the time women can get pregnant, let's say 20 to 40. So now so when they finish their pregnancies, like let's say they're 40. So now that brings the age group that you have to monitor strokes and blood pressure, brings it down from 65 all the way down to 40.
Well, it has always been the case. Not that it's brought down, it's just that we become more aware, as you have adroitly pointed out, and that, of course, we have Black men and women who drive strokes in their 30s and 20s. It's interesting that you bring that up, because sometimes people don't recognize that in young people of color, the blood pressure elevations begin at the age of 12. And so that the younger you are, the more important it is to get your blood pressure checked to make sure that you don't have it. And if you have it, to get it controlled. And the earlier you control it, the better. But there's no, I guess under 12 is probably the youngest age in which you need to not worry about your blood pressure. After you reach the age of 12, then the blood pressure should be monitored. Any other comments or questions about that topic? It's so vital for us, and as your children and your grandchildren, as after they have pregnancies, that this is a problem that surfaces after the deliveries. So, especially the women, since women have more of the strokes than men, it's a concern. But it's a concern of all genders, but strokes seem to be more common in women than in men. Okay, any other questions about that? Because I think that's a subject that and diabetes are subjects that are with us every day. Okay, Buchanan, you can start the graphics. Has interesting topics that we're addressing. I thought this was of historic importance. It's tragic that in 2022 we're still talking about first of everything, which is a sad commentary, but it's something to appreciate, the fact that we're getting there. He's the first to have that historic position in the House of Representatives. A Democratic Party leader, that's wonderful, and something that we are happy about. And hopefully we'll get to the day when we won't be talking about the first of anything, because we will have already been there and done that. But we have to be appreciative and grateful for those people who make it to the top as the first. Mm-hmm. Any comment about that? Any of you know him? Okay.
I know what you're talking about, Dr. Callender, when you say the first of this, the first of that, because they do the same thing with women. They say the first woman.
Well, it was interesting, because I was at one of my surgical meetings, and they had the first woman president of that surgical organization. They've been in existence since 1875. So I thought that, everybody stood up and applauded. I didn't, because I thought it was disgraceful that they took that long to have a woman president. But yeah, it's a fact of life. But it's yeah. But women and blacks, it's interesting how blacks in many ways have led the way for women to follow in their footsteps and to get a lot of the rights that they richly deserve. I put this one in there also because frozen pipes, are they covered by insurance? And this is something that I've had some people who have left their homes, and in the wintertime, they didn't keep the temperature high enough. As a consequence, frozen pipes burst and they flooded the house. And so when they went to try to get insurance, this is the exception I want you to look at that indicates that that it is required that you keep your house at a certain temperature, whether you're in it or not, so as to keep your pipes from bursting. And if you don't do that, then the insurance may or may not cover your frozen pipes if they burst and cause floods. And I'm sure all of us have had floods at one point or another in homes, and of course that's disastrous, and it takes a long while to overcome. Any comments about this? Although some of you may think it's unnecessary, but something to be aware of.
I don't see how the insurance could monitor it.
Oh, well, the insurance can't monitor, but if after you indicate that the pipes are frozen, if they ask you, was somebody in the home? You say no, and say, was the temperature regulated? Then if you give an answer that indicates that the house was not kept warm, then that would make you vulnerable. But you're right. They don't have a way of monitoring it.
Right.
Yeah.
It's up to you.
Insurance excludes damage that results from improper maintenance. So that's
Right.
why they talk about keeping the temperature in your house adequate, because that's a part of maintenance. And so the outcome is typically that there's going to be a cost to repair the broken pipes that insurance doesn't cover, but the ensuing water damage that happens when because you break the pipes and you get leaks, and so then the water leaks through the house and you get ensuing water damage, which is covered by insurance.
I have an experience with that at my mom's house. She was out of the house at this point. I think she was in assisted living, and the property manager went on vacation to Jamaica and did not take care of the pipes, and the pipe ruptured in the, believe it or not, in the kitchen, and up on the second floor, the pipe burst in the kitchen and it flooded the kitchen and the dining room and the living room. I mean, it's terrible. Went all the way down to the basement. So this is a real thing. Some people just say let the water drip in the house. That's another way to keep it from bursting. But that raises your water bill a little bit, if you do that. But the best way is to turn the water off on the outside, I think.
And that's what they recommend. Okay, well, that's the topic I thought that homeowners should be aware of, because we've had floods, but not from the frozen pipes, but water and fire are two of the most damaging items that you can address. They're so dangerous. Water is so powerful, and fire is so powerful.
Mm-hmm.
Okay, well, I just thought I'd bring to your attention because it's something.
Dr. Callender, one other thing, it's a good thing about turning the outside water off, because most of the time there's only one main line coming into the whole house. So if you turn that one main line off, water won't come.
Yeah, right.
Yeah, but then you won't have water to your to your sinks or anything.
Well, that's assuming you're not in the house.
Yeah.
Okay. Yeah.
You're out on vacation or you're gone
Right.
somewhere for.
Right.
Yeah, correct.
Yeah. I thought this was an interesting article. I'd lived to 100 before developing clinical. And they talk about LDL, which is the two cholesterols that most people monitor, are the HDL, which is the protective cholesterol, and the LDL, which is the cholesterol that damages the vessels and results in arteriosclerosis. And many of the studies have demonstrated that that medications will help to lower the LDL, and not so many can help with increasing the HDL, but the LDL can be lowered by anti-cholesterol medications that many of you take, and that also recent articles have demonstrated that these medications will also decrease the likelihood of having hemorrhagic strokes, as well as decreasing the likelihood of having arteriosclerosis. So the statins are the medications that many of us are on that are recommended people over 50 who have cardiovascular disease. But the when you talk about things that you should know what your LDL is, your HDL, your hemoglobin A1C, your blood sugar, and your hemoglobin as well. And so this is the cholesterol level is something. Many are on statins to control the cholesterol and to address this, but so they are suggesting that some of these medications will help you keep your cholesterol in the level that it ought to be, because recommended it should be far less than 100, and ideally between 60 and 100. And this then would result in you not having deposits in your coronary arteries, which many of us do over the age of 40. So that's why this is an article that, and it's interesting that some of the recent studies have demonstrated that people who take the flu vaccine have an added advantage in that it also lowers the cholesterol, which is a mechanism by which is not as clear, but it's something that they've noticed. Any questions about this and the role of the statins and other medications like them and preventing heart attack, because that's what they're talking about. If no question, let's go to the next. Because this is, as we mentioned before, the #1 killer in the world. So this is a subject that has been broached on many of our sessions. And how much water should you drink a day? And there are those who drink 2 to 3 liters a day, and those who drink 1 liter or less a day. And so is it true that one size fits all, or does it vary according to you and your body? And so this article suggests that the amount of water you drink is not a one size fits all. And although it is desirable to lead at least 8 ounce glasses of water a day, and an ounce is 30 cc's. So you're talking about 40 times 8, which is about 2 liters a day. And most people think that's about what you need to have. But you have some people who drink 6 liters a day. Some people who drink 500 cc's a day. So the question is, what is best for you? And so the bottom line is that most people think 1 to 2 liters a day is sufficient. If you're drinking less than that, they recommend you drink more. If you're drinking more than that and your body finds it suitable, fine. But water, too much water is just as bad is too little water. So the right amount is what you should do. And we're blessed to have access to safe drinking water, and we now buy water. You know, it used to be water was free, and now you buy water. So then,
I have a question. One time a doctor recommended that you drink the same amount of water that you put out. I know it's difficult to estimate, the amount of urine that comes out, but he suggested that you balance it. The same amount that goes out should replenish. What do you think of that?
well, I think you should do maybe a little bit more, maybe about 500 cc's more, maybe. But it's impractical. That's the problem with that. It's impractical because nobody measures their urine when they go to the bathroom. Very few do. Let's put it that way. And so therefore, drinking approximately 2 liters a day is about what you should put out. But I don't know anybody who measures their urine when when you go to the toilet, you don't know which toilet you're going to. And so quantifying exactly how much urine you make seems to me a little bit impractical. But if you could do it, it'd be all right. I'd balance it, but I just take a little bit more than you put out.
Thank you.
I just go with the color of my urine. I know if it's getting dark, I know I need some a hydrate.
That's pretty good, yeah, because you want to be light yellow or yellow, and if it's dark yellow, towards brown, it suggests you're dehydrated and you need to drink much more water than you're taking in. This is something that I was a little surprised that women have that much more adverse drug reactions. And it's a sad commentary that for many decades, research was done on men only. And so they didn't even know the difference between the issues that relate to gender, whether male or female. And so they assumed everything that was true for males was true for women, which is not the case. So research now requires that you not only have ethnic people in research, but also gender, equal amounts of genders, because there are sex differences that matter. And this same thing is true about drugs. They did all the research on males, and therefore the issues that related to females was never in the equation, and therefore they were pretty ignorant of this until it turns out that women have more adverse drug reactions than males. And some of these adverse drug reactions are lethal. Some are problematic, but not lethal, but some are lethal as well. And we'd like to talk about what medications are safe. Probably the safest medications are air and water, but everything else is associated with side effects. And if you ever want to have a frightening experience, look up the side effects of any medication that you take. And it'll frighten you because there's so many side effects. Now, the question is, what do you tell your patients about the side effects? And should you make them aware of the side effects? Will that frighten them, or is that part of a good practice of medicine? And most of us feel that we should let them know what are the common side effects, but let them know if they have any side effects, they should get in touch with their physician. And they're suggesting that the gender matters because the gender has increased fat mass, and that is one of the reasons why you have sex differences for adverse drug reactions. And the only way you can find out is by case. And so the doctor-patient relationship and the discussion of what changes have occurred since you've taken this medicine become very critical.
Dr. Callender, can you imagine a time when you get a prescription of something and the pharmacist has one prescription for male and another prescription for female, same medicine. So they every time you go and get a prescription, there's always a male version of the prescription and a female version.
Well, I've not heard that at all.
No, I'm saying, can you imagine that?
No, I can't. Because one size doesn't fit all and one gender doesn't fit all. So, yeah. Okay. Now, this is a subject that many of you may not be aware of, but there have been many who say that in China they procure organs before brain death. And there have been a number of accusations made. This is an article that allegedly confirms that in China they were doing transplants of people who were criminals but weren't dead before they took their organs. And so this is something that I've been reading about for the last 30 years. And the transplant ethics is what we're talking about. And as you know, the donation can be done in live if you're willing and you give consent. But without consent to take organs from criminals and other people who have not consented is thought by most countries to be illegal, although in China, apparently that's not the case. But there's been many articles that have talked about the fact that in China, this has been going on for quite a while. And I thought I'd just bring it to your attention that this is a legitimate concern, just as in other countries, they pay for organs. And that is illegal in our country, but in some countries, people are paid for donating. And we think that's not good for people who are poor, because they would then disproportionately be the donors. And that, of course, is problematic. But there are many countries for whom paid donation occurs and is the rule. But anyway, I thought I'd share this with you to see if you had any comment about it. Any thoughts about this practice in China that apparently is not going on anywhere else in the world, even though paid donation is taking organs from prisoners and criminals without their permission is not something that, and transplant tourism is the term they use for a situation where people go to other countries to buy organs. But they not only do that for transplantation, but for other procedures that they think they can get more cheaply. Like some people go to get bariatric surgeries in other countries, and some have done well and some have not. And so that's why the surgical tourism is an issue that still is evolving. And since China is the world's second largest transplant country, it's important that it be known the ethical issue of it is up to the Chinese, but the rest of the world does not look fondly on it. Any comments, thoughts? If not, I just thought it might be good for us to know what's going on in the rest of the world. This is an article that talks about the 2-dose vaccination for immunocompromised adults. I just had one of my transplant patients who died from COVID, and the importance of the bivalent vaccine becomes critical, especially for the immunocompromised, because as we know, the standard doses of the vaccination may or may not allow for effective immunization of the immunocompromised by virtue of the medication they receive, or whether they're anti-cancer medication, so forth and so on. So for that reason, it's important to people who are immunosuppressed to take the bivalent antibody. And as we have variation on a theme every 6 months to a year, it may well be that you may have to take boosters every 6 months, every year. We don't know yet, but anyway, it's something that we're learning about. But I think the last meeting we had, we talked about the fact that death among the vaccinated people is increasing. And so it's important to be updated on your vaccinations. As the virus varies, we have the different varieties.
Once a year. Dr. Callender, this is Sylvia. My husband, Charles, he received an email saying it's been 2 months since you've had your last booster shot, and they were recommending that he takes another one.
Yeah, I got the same email. Yeah,
So,
I ignored it, but because it's, I think after 6 months, it makes sense. 2 months, I don't agree with that.
okay.
I got the same email.
Oh, okay. I'll let him know.
Yeah.
Thank you.
I think they say that the real time at which you need to, unless the variants are found to be unique, 4 to 6 months is around the time that you need to get another booster if the variant's mandated. 2 months is a little early. It's very clear that the updated booster shot, and that's talking about the bivalent. And I think that thing that set out was for those who have not yet received the bivalent. Those who received the bivalent, it appears the variants are treated by the bivalent booster shot. So as the new variants appear, then we'll have to be educated about that. But right now, we haven't gotten the information on it. And there are new variants that are coming out. And the question is, will our vaccine protect us? And so we will wait the studies to tell us. But it is appear that has been effective at reducing hospitalizations and deaths by at least 50%. But that still means there are people who have been hospitalized and have died. Any comments or questions about this? And I know there's some people on this line involved with the RSV vaccination attempt. The previous vaccination attempt at RSV was unsuccessful. And so we're looking forward that this will be successful this time, since it wasn't the last time.
Dr. Callender, I had a question about the people who are highly immune suppressed, and they end up in the hospital because of COVID, and they end up dying. My question is, what does COVID do while they're in the hospital? Does it attack other organs? Is that the issue?
There's no question that it attacks other organs, but the real issue is that it evokes an immune response that causes the body to attack itself. And that's why the medication is only, I guess it's just one medication that's been effective. Most of the others have not been. And that medication has contraindications for people who are on other medications. And so there are people who need to take that medication but can't take it. And so, and most of the monoclonal antibodies have not been effective against these subvariants. I don't know, does that answer your question or not?
Yes, it does. It does. Because what COVID does is bring.
Oh yeah, it attacks almost. The brain is well known, the lung, the kidney, the blood system itself. So yes, it is. It is known to attack almost every organ and tissue of the body.
Exactly, and what I was going to say is that it brings your immune system down even lower so that you can get other infections.
Yeah. And so I think one of the things that we have to look out for is to see what is the evidence as these new variants appear in terms of the effectiveness of the vaccine. Because if the vaccine appears not to be effective against these variants, then as Sylvia had asked, then it would be important after 4 to 6 months to get another booster shot for a vaccine that is effective against the variant. So we'll wait for the studies to get a better answer to the question that was raised. But again, 2 months is a little early. I think everybody in Maryland may have received the same text.
I didn't receive the text, but I feel like more and more people are getting COVID again. A lot of people that I know have had it once, twice, 3 times. It's like a cycle. It continues to go on and on. Adults and young adults as well.
Yeah, just as the flu.
Mm-hmm.
Yeah, same thing. Yeah. And it appears that, as we talked last time we met, that the adults in the age of 25 to 54, middle-aged, are the ones who seem to be suffering more than others. They allege that that's mainly because they're the group that is under-vaccinated. But as you pointed out, there are people who are vaccinated who haven't received it. Right.
I have a friend who had it 3 times, and I think this is the 4th, or maybe this is the 3rd. And she has an autoimmune disease, osteo something, and they put her on Paxlovid. But I know we've discussed in the past that sometimes being on that, like Biden, you get a rebound.
Well, but we also, we discussed, you may have missed the meeting, but we also discussed that the rebound is a positive thing. And that it does not mean that the antibodies, that the medication not working. It means the medication is working. And
right.
so it's a good thing. It's not a bad thing. So
Oh yeah, yeah. And I realized that, and that's what I tried to tell her. 4 days before she was supposed to go on a trip, she was going to Portugal, and she got COVID again. And she had COVID last year at Christmas, this year at Christmas. And so she wants to reschedule this trip to Portugal. I suggested waiting until spring because we've discussed you do have the rebound sometimes, but you can't stop it, I guess. You know, there's
well,
no way of getting around.
the rebound only occurs after about 5 days.
Right.
Then
Okay.
it goes away.
Give it time. Mm-hmm.
So, yeah, I think rescheduling it makes sense, but I don't know when she should reschedule it. That's
Mm-hmm.
yeah. It's clear that especially with the RSV and flu, that the question of remasking becomes an issue, as this article points out. However, you would never believe that when you go out in the community, because almost nobody wears masks anymore.
Mm-hmm.
And of course, now I noticed that the public transportation is going to be free in the district in the summer. So it's going to be interesting to see. But most people don't wear masks anymore. If you wear a mask,
I went to a hockey game last Thursday, and my son and I were the only two to have masks on in the whole place.
What about the people who work? They don't wear masks anymore?
Very few. Very few.
Because when I went to the basketball game, all of them wore masks. All of the attendants wore masks.
Mm-hmm. This was at Capital One.
None of the people, none of the fans, but the attendants wore masks at the Capitol Center. Yeah, one Capitol Arena. But you went to a hockey game, or what was it?
That was my first hockey game last Thursday.
Ah, well, it was crowded. It doesn't sell out every game.
It was crowded, but you know, I couldn't believe what I was seeing. Nobody in the none of the fans.
Yeah, right. None. That's amazing because when I go to basketball games, I walk around, man. It's lonely in terms of looking for other people with masks, except for the attendants.
Well, you know, and it's a mindset, you know.
Yeah.
They're not worried about giving it if they have, you know, the virus to somebody else, but I'm concerned about my own health and the health of my wife and my kid, you know, and my grandkids. So I don't want to contribute to the spread. But there's a whole lot of people. Oh, the other thing is that they did a study along party lines, political lines,
Yeah.
that they found that a lot more, I think 60% of Republicans did not get vaccinated, did not get boosted, and only 40% of Democrats did not get the boosters.
Yeah, it's Tony Fauci made that comment, and it's disturbing that you would believe that people would follow Trump like that. That's amazing, but that is kind of disconcerting that they would go across party lines like that. But I guess they're following their leader. So, can you say?
That's also weird because he got his vaccination.
Finally, yeah. But he was leading them along those lines. So, yeah, that's disturbing. That I think Dow mentioned many times that it's kind of disturbing that our country which has more COVID deaths than any country by far, should have such a low, relatively low vaccination. Well, the thing that frightens me is that I don't see it getting any better. You know, we see these articles, but the public doesn't seem to be paying much attention. What can we do about it? Continue to be masked and be consistent with it. I think that's what we can do. And hope that people will understand, especially when you go to public transportation or to big events like you're talking about. Because there's a tendency to become complacent and to do what they do. And that's where the danger comes in.
We rode the metro, and so masks are not required on the metro anymore. Even though they're recommended in the subway, but and that was
they're encouraged. Encouraged. What does that mean?
Yeah, it's crazy.
Yeah.
We got more articles about this too. And masks help with the flu as well.
That's the thing about it. It helps with the flu and RSV as well. And so, but they don't seem to understand that. And of course, it's even more important with RSV because there's no vaccination. At least with the flu, there's a vaccine. And with the COVID, there's a vaccine. But RSV, there isn't.
Dr. Callender, something interesting happened while I was in the rehabilitation center and the hospital, for that matter. They said that as a patient in there, I didn't have to wear a mask, but everybody that came by my room, doctors, nurses, attendants, whatever, they all had to have masks on, but they did not require me to wear a mask any of the time that I was bedridden.
Well, if you're testing negative, I guess there's no reason for you to wear a mask. But that's interesting.
Yeah, my
the hospitals still, even though the CDC is done away with the requirement, the hospitals still require the staff to wear masks. This was, I think, a very interesting article because the triple-demic, as they call it, with the RSV, COVID, and influenza, is something that is for real. And as we had these Thanksgiving gatherings, Christmas gatherings, it's important to recognize that and to be sensible. But what does sensible mean? Does that mean that you have a Christmas gathering, but you have people who wear masks? Or what does it mean to you? I think most of you are going to have Christmas gatherings. What are you going to require of the people who come? Anything? Nothing? What are your thoughts?
Make sure they're vaccinated and boosted, or at least ask them. And as much as we can here, separate. Now, I tried that at Thanksgiving. Some family members took offense.
Oh, yeah.
I mean, really, it was a big deal.
Yeah.
And a few of them chose not to come. And that was okay. So Christmas, we'll do it again. Big group, small group, I don't know. We had 15 at Thanksgiving. And, but I said, spread out, definitely have to be vaccinated. You have to be boosted. If you think you have a cold or a fever,
Stay home.
Don't come. Yeah, just don't come.
Any other thoughts out there?
Yeah, I'm traveling up to Boston for the holiday, and the folks we're staying with not only required a negative COVID test before coming, but also they didn't even want me to go to my regular activities like swimming or playing music or anything like that before I came. You know, your symptoms don't show up immediately. They might take 2 or 3 or 4 days to show up after exposure. So that's.
So they prohibit you from doing that?
Say that again.
They prohibit you from performing?
If I want to stay with them, yes. Yeah. So luckily, I didn't have any performances this weekend coming up, so I should be okay. But one of the family members is immunocompromised, so
I see. Yeah.
We want to make
reason.
Sure
Good reason.
It's all compatible with what they want,
Hey, Dr. Callender, this is Sylvia. I had tested positive a couple of days ago, and I took another at-home test yesterday, and I still tested positive. So I was going to CVS to get one of those rapid ones to be sure that the home tests were, I guess, accurate. I was just wondering, if I do test negative, is it best still to stay away for a couple more days?
How long have you been positive?
5 days.
Oh, well, that's what the CDC says. Well, after you test negative, as long as after 5 days, you're supposed to be okay. That's what the CDC says.
Okay, after 5 days, testing negative.
If you're negative. If you're positive, stay home. But if you're negative, you can go out.
Oh, so that puts a damper on my Christmas plans.
Well, if you're still positive, yeah.
Yeah, if I test negative on Friday, I still need to wait 5 days.
No. They're saying 5 days after you got the infection, if you test negative, then you can go out. If you test positive, stay in.
Yeah. Okay. All righty. Thank you.
And then there's been a lot of debate on that, because some people still have debate about whether the rapid test is good enough or whether you need to have the DNA test. But the CDC has said 5 days after you've had the virus, assuming you're boosted, which you are, that when you turn negative, then you're safe.
Okay. All right. Thank you.
Dr. Callender, another one of the articles we had a couple of weeks ago, I think, said that folks who are vaccinated and boosted, especially the triple boosted, are less virulent, less likely to spread the COVID.
Yeah, that's right. Yeah, and that's why they say after five days, if you test negative, you're safe to go out. That's what the CDC says. So. But you have to test negative, though. Yeah.
And the main thing is don't assume. And we all get different symptoms. And I had COVID. So 5 days later, I went to a medical facility to be tested. And I assumed I was okay. And I left. They called me back and said, you're still positive. And I remained positive for 11 days.
Yeah.
Mm-hmm.
Yeah, it varies. It varies. Some people.
Yeah.
What were your
symptoms? We read about the longest one was 100-some days.
Mm.
What were your symptoms?
None.
Well, for me, one day I just realized I was super tired. And I wanted to go back to bed, which I never do that. I get up, make the bed, and I'm out for the day. And I stayed so tired. I said, let me test myself. And I was positive. I slept for 3 days.
Wow.
That was it. No headaches, no stuffiness, no fever. I slept for 3 days. After the 3 days, I felt I was fine. That's why the 5th day I went in to be tested, and I was still positive, but remained positive. I felt fine. So different strokes for different folks, I guess. I don't know.
Yeah. My symptoms started with a scratchy throat. And then for the next 2 days, I was in the bed just tired and had slight headaches and chills. But after the 3rd day, I was feeling much better. And right now, I still feel better. I have a hoarseness in my throat, but I feel fine. I feel fine.
You sing, right?
Yes,
Can you sing?
Yes, I still can sing.
Is your range the same?
I'm sorry?
Is the range the same?
I don't know if it's still do, re, mi. Well, John, you tell me. Do, re, mi, fa. See, you hear that?
Okay.
Uh-huh.
No, the range
It's
is not
affected.
Yeah, it is.
What, did you
That's
test,
how you
did
can
you
tell
test
it.
positive?
Yes.
Okay.
Yeah, the range is gone a little bit.
Uh-huh.
It'll come back.
Yeah.
Hey.
And Dr. Callender, in my situation, we're going to have guests over for Christmas. And so family and guests. And what I think I'm going to do is, those people who are 65 and older, and those people who are immunocompromised, they are the ones that have a high risk of getting infection. So they should wear masks. I'm going to wear a mask. So when we greet people, when they first come in and you greet them and your mask is on and blah, blah, blah. When you sit down to dinner, that's probably when you can lower your mask.
Well, you can't eat with masks on.
Yeah, you lower your mask, go ahead and eat. And then when they get ready to leave and everything, you can put your mask back up. But hopefully the issue is this. When people come over to your house, you expect them not to have the virus. You expect them to be well. And, you expect them to be negative.
Yeah, but expecting and requiring are 2 different things. You can expect anything you want, but it doesn't mean that's going to happen.
Yeah, I'd have them wait in the parking lot and take a COVID test. Show me the test.
Dr. Callender, my daughter's in town from Illinois. I just have a mask on around the house. Is she, I know they say that those who've been triple boosted are less likely to spread it. Is she okay to go out and, she's here visiting and I know she wants to go out. Is she okay to go out?
What, she's positive?
No. She hasn't caught anything. I'm the one that's positive. She's
she living in the house with you?
She's visiting. Yeah.
Oh.
So should she be going out?
Has she been tested?
No, I can test her. Do I have an in-home kit?
She needs to be tested.
Okay. All right. We'll test her.
And if she's negative, she can go out.
Okay.
But if Sylvia is quarantined, trying to stay in one room only, that would make it safer.
I'm staying my distance, and she's in another room, and my husband's sleeping in another bedroom.
And so test her and make sure she's negative. She's negative, she can go out.
Okay, I'm sure she's glad to hear that.
Well, and then this is good news because I know once you get positive, you use up all your COVID tests, so you got to go buy some more. And so they're going to send out 4 for each family. Of course, it makes you wonder about your privacy. If they can send you 4 COVID tests, and they know you well. Yeah, they know you well. So those of us who think we have some degree of privacy have to think again when they receive your free COVID tests. But it'll be welcome. Be welcome. And I think this is good news. I think the more people have COVID tests, the more they can find out for themselves whether they're positive and also quarantine themselves appropriately. In terms of Tatum's situation where the people are going to have no mask because they're eating, I think that's a tough situation for the compromised patients.
Exactly.
Yeah, it's kind of dangerous. Yeah.
I'm sorry. I'm pretty sure that's how I caught COVID the first time. It was at a banquet, and I had mask on the whole time except on stage and eating. And I'm pretty sure that eating at the dining table that's how I got it. I'm pretty sure.
Yeah, I think it's dangerous for compromised patients to do that. But anyway.
What we try to do here, the seniors, we separate ourselves and we eat separately from them. I can do it with the way the house is set up.
Oh, yeah.
Yeah, as much as you can, just separate yourself. You can see them, but don't come in this section at all. Anywhere. No hugging. No hugging.
How does that work out?
Fine. They understand. And it's easy to do it the way the house is set up. Plus, I have a basement, and the younger ones and others, they tend to go down there too. The seniors, we stay in one area. We take our masks off. We can eat together. Mm-hmm.
Well, the younger ones are more likely to be infected, though.
And that's why they're separate from us.
Mm-hmm.
Yeah.
No, you don't have to hug. I see you. Hi, bye. Merry Christmas.
Interesting.
Any
comments?
By the way, Dr. Callender, just a quick thing. Joyce had to get off, and so she wanted to wish everybody Merry Christmas.
Thank you. Well, it's just lost one of my transplant patients who couldn't take. Anyway, they didn't offer him Paxlovid, and I regret that. But he was in St. Thomas Virgin Islands, so they may not have had it available. But Paxlovid is the one treatment that has been effective.
Mm-hmm.
And making vaccines and boosters accessible to everyone is a situation here in the United States, but people still don't take advantage of it. There was an article recently that suggested that some of the nursing homes haven't fully taken advantage of it, made sure that their residents are up to date with the boosters. And this encouraging mask is an interesting aspect of it that seems to have failed. So encourage maskings is like letting people know that you got fentanyl and you can take it if you want. But when you look outside and you see how people respond to encourage masking, about 99% don't mask. So I wonder about the effectiveness of encouraging a mask. Any thoughts about that? Now, what are you guys doing in Chicago?
Oops. Okay, there I am. Yeah. We're just, my fiance and I are just having Christmas to ourselves. No guests.
Okay. All right.
Dr. Callender,
What's the temperature there?
Temperature right now is really warm for Chicago. It's 29 degrees, but at noon, the weather's going to dip into the single digits, and we're expecting upwards to 2 feet or more of snow.
Wow. Marilyn, you had a comment?
Yes, sir. I went to a funeral last week and everybody there had masks on. The gentleman whose mother died was sitting in front of the church with a mask on, and we stopped to talk to him on the way in, and he never came in. And it wasn't until just a few minutes ago that I found out that he had COVID.
Oh, really?
He didn't tell anybody. I guess his family knew, but he didn't tell anybody. And people were coming up to him, seeing him, hugging him,
Really?
touching him. But everybody had their mask on. And now I find out that he had COVID. That's why he was outside the whole funeral.
That's novel. No comment.
That's crazy.
No comment.
I actually like having my mask on when it's cold outside. Keeps my face warm.
Yeah.
This is an interesting article about Strep A, usually mild infection killing kids in the UK. And what happens in the UK sometimes happens in the United States. This is something that we hope stays in the UK. Strep is usually easily treated. But I know my daughter had a throat infection, which lasted for 2 weeks in spite of treatment. So, and this, of course, is a well-known infection that can result in kidney disease with antibodies developing later that knock out the kidneys. So streptococcus is a bad bug, especially if it's not treated early. Necrotizing fasciitis and other toxic syndromes can occur, but it's especially in older people or immunocompromised people that you have a problem. Finding it in young people is a surprise, especially to find that it has been fatal. So the question is why and what we can do about it. And I think, I don't know the answer.
Dr. Callender, was that your sister-in-law's funeral that you went to last week, and what did she die of?
What was the question?
The funeral that you went to last week, was that your sister-in-law?
Yeah, everybody had on masks.
What did she die of?
She had a stroke.
Okay, thank
you. Yeah, it's a woman who had a stroke, which is the commonest cause of death in women in this country. And she had a stroke. She was found down at home, and she'd been there for hours. And by the time they got to her, not anything else they could do. So. What you do if you think a child has strep A, then we have good antibiotics for strep A. And they need to be put on antibiotics. Usually, penicillins are effective, amoxicillin, erythromycin, many of those medications. Treating it the earlier the better. Yeah. And they saying the same thing that you said, Janice, if you're sick, stay home.
That's right.
Don't come to my house if you're sick. Stay home. Stay in your house. Yeah. And then, of course, the same old rules apply. Wash your hands frequently. Social distancing. Face masks. Okay, let's go to the next one. That's it, huh? Okay. Oh, 10:15 already. Any other comments? Any subjects you want to address?